grandma says to this, I never gave or took an excuse. As Florence Nightingale once stated, as cited by Wikipedia, I am pleased to be able to speak to you about Florence Nightingale's persistent and hardworking attitude that has paid foundation which nurses are educated and the standards of care patients nurses follow now. Florence Nightingale, also known with the Lady with the Lamp, as cited Gillian Gill book. At Bragg Hospital during the Crimean War in 1854, she worked the hospital when nursing wasn't a respectable profession. She went to the hospital with 28 other nurses. When they got to the hospital was very unsanitary. No running sewers, no fresh air. They found dying soldiers next to acutely ill patients. Some of the soldiers were dead next to other living soldiers. They had no clean gowns. They had no clean bedding. Their dietary intake was not being met. So Florence Nightingale came up with an environmental theory for nurses. The theory was that if you give patients a clean environment and take them and give them dietary intake, that it would improve the healing process. She also monitored. Florence Nightingale came up with the environmental theory. If patients were in a clean environment, that they may help the healing process. She also monitored their dietary intake and how that helped patients heal. She worked day and night to come up with the resources to clean the hospital. And even though patients were still dying, just that idea that she moved the patients away from the sewage, and the patients tended to get better. And then once they were bathed, they still continued to get better. And if their dietary intake was met, the patient seemed to heal faster. She worked out all hours, sometimes 20 hours a day. She rounded on patients at night, which was where she got the Lady of the Lamp title. It was said that when she rounded on the patients at night, they felt a sense of hope, that they had the hope to maybe get better. And sometimes she wouldn't even hardly go to sleep. She steadily rounded on the patients because nobody else would. After she left the Bragg Hospital, she opened up the first non-religious hospital, St. Thomas, in London in 1860. She wrote the note to nursing. She helped educate other nurses on the holistic care of patients, their environment, their dietary, their if you clean them, the cleanliness of the patient, all that helps the healing process. And sometimes just sitting there talking to a patient helps that's a holistic care of patients. Florence Nightingale was also a brilliant mathematician. She also kept up with statistics of nursing care. The Nightingale Rose diagram was used to keep up with patients' mortality rates. Like, she was really concerned that if patients were dying, and that you needed to keep a record of it, of how many soldiers died. Not very many other places were doing that, so she reached out to the other places to see what kind of theories of nursing they were using, to base it on hers, to see if actually her theories were helping the mortality rates, and which they were. Florence Nightingale will forever be a part of nursing history. Being a nurse myself, I look at her achievements and respect the theory of nursing that she brought to modern day nursing. Without Florence Nightingale, we may not have the hospitals we have now,